Hello, I'm going to talk to you about specific needs for designing aerobic exercise programs for individuals. To begin, most individuals would need to be evaluated so you can tailor the program to their specific needs and what they can and cannot do. Generally, a PAR-Q is a good place to start, and it leaves you make sure that you're not liable if things go wrong. Then you must know the risk categories that each client would fall into. Remember, these are just general categories. These are not set in stone. Low risk would be men 45 or older, and women would be 55 or older, generally to fall under the low risk category. And they would have no more than one of these risk factors: coronary artery disease, smoking, obesity, or a sedentary lifestyle. To fall under the moderate risk category, men would still be 45 or older, women would be 55 or older as well, but they would have two of the risk factors that I just listed. Remember, these are just general. And to be a part of the high risk, in the high risk category, individuals with known cardiac, pulmonary, or metabolic diseases would automatically fall under the high risk. You would have to take that into consideration designing their program. Or if they have symptoms of cardiac, pulmonary, or metabolic disease, then they would fall under the high risk. Now we're going to talk about just basic programs. Before basically doing any program, they would need to warm up, and there are many benefits of warming up. The muscles contract faster at a higher temp. The increase in temperature decreases resistance, and it also increases the efficiency of muscle contractions. Increased blood flow to the muscles and temperature of ligaments and tendons also when you warm up. Plus, warming up reduces the risk of muscular injuries, muscle pulls and tears, and damage to the connective tissue. And some physical activity guidelines for basically any adult, which is still a general statement because people differ from their lifestyles or the jobs they work or stuff like that. Generally, adults should do at least 150 minutes of aerobic exercise per week, and that's moderate aerobic exercise. Or if they wanted, they could do 75 minutes a week of vigorous aerobic exercise. But really, that's really not ideal if you're going to do vigorous exercise every day of the week. So if you wanted to mix them up and do vigorous 2 times a week and moderate 3 times a week, that would work. You would just need to follow the guideline of probably 75 minutes. And when you're designing a program and a principle for aerobic exercise, you need to remember the FIT principle, which stands for frequency of the exercise, intensity of the exercise, duration, how long you're going to do it, or how many days a week you're going to do it, and the type of exercise. So FITT. And then we're going to talk about detraining. Detraining improperly can cause decreased cardiorespiratory fitness in as little as 2 weeks. And then after 10 weeks of improperly detraining, you're basically back to zero, right where you started. Lost everything. Properly detraining can maintain your fitness level, and it can keep you at basically where you were when you were trying to reach your goal. And then obviously some factors affecting your endurance performance would be your VO2 max, your anaerobic threshold, so how much anaerobic exercise you can withstand, and the efficiency of movement that your body allows. Thank you.